So there are four pillars of medical ethics, mostly beneficence, non-maleficence, autonomy, and justice. These are the four pillars of medical ethics. Whenever you are going to try to answer the medical ethics, whether definition you write or not, it hardly matters. But when you write, these are the four pillars of medical ethics. This is the cue point, or this is the cream of the and cream to the answer of medical ethics. Beneficence means just doing good to the patient, never harm the patient. Nullification means do not harm. Autonomy means give the patient freedom to choose the type of treatment or type of drugs or type of procedure they want, where they are able to, where they are able. So it is the perfect justification or perfect liberation or perfect freedom to the patient. They can choose their own treatment protocols. They can choose their own doctors too. So justice means we always ensure fairness in the medical ethics, because medical ethics, we always tell that the patients have to be treated very nicely, in an ethical manner, in a programmed manner, in a protocol-based manner, so as to not to harm any patient and give justice to the patient. So these are the four pillars. These are the Indian Medical Council of Professional Conduct, Etiquettes and Ethics, Regulation 2002, have given below four major duties and responsibility of the doctors in general. So in order to implement this medical ethics nicely in the medical service, our IMC, or Indian Medical Council of Professional Conduct, Etiquettes and Ethics, Regulation 2002, they are given a major duty and responsibility to the doctors. First is maintain good medicine practice or maintain a good medical practice. Physician must respect human dignity, continually improvement skills, share knowledge, follow scientific methods, engage in medical societies. So we have to engage in Indian medical societies or state medical societies, like in our Odisha Medical Service Educations and Odisha Medical Service Associations, and participate in different CME programs, different workshops, and different conferences, so to increase our knowledge. This is our main job. So maintaining the good medical practice. Use of generic name of the drugs. Never prescribe the branded drugs. Always you try to use a generic name of the drugs. Should prescribe drugs using their generic name. Ensure the use is very rational. Don't run after pharma companies like that. So in anesthesia, we hardly run after any pharma companies. We mostly prescribe our general drugs. Highest quality of assurance in patient care. So whatever you are doing is the secondary thing. There should be a higher assurance in the patient care. Patient should prevent unqualified individuals from joining the profession. So there should be a very streamline of joining in the medical service. Ensure only registered attendant assist in the practice where professional skill is very much required. So besides medical practitioners, they also hire the OT technicians or the paramedical staffs in a very qualified manner. So there should not be any wrong in the OT or in the medical practice. Exposure unethical conducts. A physician should expose, withdraw, fear or favor, incompetent or corrupt, dishonest, unethical conduct on the part of the member of the profession. So we should not carry out unethical means of financial income, or we should not be dishonest to the patient. Evasion of legal restrictions. Physician must follow medical laws, enforcing sanitary regulations, comply with various health related acts. Government of India or state government also, they formulate different health related acts and regulation of the public health protection. So suppose medical ethics comes as a question of 5 marks. If you write 4 pillars of medical ethics and you write 4 to 5 points from here, suppose you also write that the Indian Medical Council, the professional conducts, etiquettes and the regulation 2002 formulate this type of protocols. So it will be very eye-catching to the examiner, and definitely this type of question, if you write properly, you will get full marks. Suppose anesthesia management in a case of thyroid patient or hypothyroid patient, or anesthesia management of a myasthenia gravis patient. If the anesthesia management question came, we miss something. Even if we write pre-op, intra-op and post-op clearly, we will not get full marks, because the whatever examiner wants, we sometimes we are miss that points. But in this aspect, if you write properly 2 lines or 3 lines related to medical ethics and you properly document everything, then hardly there is any chances that you will miss marks. So these type of questions are very mark fetching questions and you have to write it properly.